Hypertension, the silent killer. Most people don't even realize they have high blood pressure until serious complications appear. That's why correct diagnosis is extremely important. In today's video, powered by BookEHealth, we'll break down the full process of how hypertension is diagnosed, step by step in simple language. Section 1. What is hypertension diagnosis? Hypertension diagnosis is not just checking blood pressure once. It is a systematic and scientific process. Doctors check your BP multiple times, run blood tests, urine tests, ECG, imaging, and even eye exams to understand the effect of high blood pressure on your organs. Let's start with the most basic step: blood pressure monitoring. Section 2. Clinic-based blood pressure monitoring. Diagnosis begins with BP measurement in the clinic. Doctors follow a standard process. You sit calmly for 5 minutes. Feet flat on the floor, arm at heart level. Correct cuff size, 2 readings taken, 1 to 2 minutes apart. Then the values are interpreted. Normal, less than 120 over 80. Elevated, 120 to 129 over less than 80 stage 1. HTN, 130 to 139 over 80 to 89. Stage 2H, TN, greater than or equal to 140 over greater than or equal to 90. Hypertensive crisis, greater than 180 / greater than 120. But sometimes clinic BP is misleading. Some people experience white coat hypertension, BP high only in clinic. And some have masked hypertension, BP normal in clinic but high at home. This is where ABPM comes in. Section 3. Ambulatory BP monitoring. ABPM, or ambulatory blood pressure monitoring, is the gold standard for diagnosing hypertension. You wear a portable device for 24 hours, which checks BP every 15 to 30 minutes in the day and 30 to 60 minutes at night. It helps identify white coat hypertension, masked hypertension, nighttime BP patterns, morning BP, surge, overall, daily BP fluctuations. Normal ABPM readings are 24-hour average, less than 130 over 80. Daytime, 135 over 85. Nighttime, 120 over 70. Anything above this indicates hypertension. Section 4. Home BP monitoring. Home BP monitoring is another key diagnostic tool. Patients measure their BP themselves, usually morning and evening, for several days. If the average home BP is 135 over 85 millimeters of mercury or higher, hypertension is suspected. This method reduces stress-related spikes and helps in treatment follow-up. Section 5. Blood tests. Blood tests help identify underlying causes and organ damage linked to hypertension. Doctors check for fasting blood glucose and HbA1c to detect diabetes, commonly associated with high BP. Lipid profile, high LDL and triglycerides, increased risk of heart disease. Kidney function tests, creatinine. Hypertension can damage kidneys or be caused by kidney disease. Electrolytes, sodium, potassium. Low potassium may indicate hyperaldosteronism, a hormonal cause of secondary hypertension. Thyroid function tests. Thyroid disorders can also elevate BP. Liver function tests, important for medication safety. CBC helps detect anemia or blood-related conditions. Section 6. Urine tests. Urine tests are vital in hypertension diagnosis. Routine urinalysis detects protein, blood, or glucose. Albumin to creatinine ratio. Early marker of kidney damage. 24-hour urine collection checks sodium, potassium, and hormones like catecholamines and cortisol. Useful for detecting serious secondary causes of hypertension like pheochromocytoma, Cushing's syndrome, hyperaldosteronism. Section 7. ECG and echocardiography. Chronic high BP damages the heart. That's why ECG and echocardiography are required. ECG detects left ventricular hypertrophy, arrhythmias, ischemia, atrial enlargement. Echocardiography shows heart wall thickening, pumping efficiency valve. Problems, diastolic dysfunction, heart failure risk. Echo is more accurate and reveals early heart damage better than ECG. Section 8. Eye examination, fundoscopy. The retina is the only place where doctors can directly see blood vessels. Fundoscopy helps detect hypertensive retinopathy. Grade 1, mild vessel narrowing. Grade 2, AV nicking. Grade 3, hemorrhages, exudates. Grade 4, papilledema, a medical emergency eye damage often indicates severe hypertension. Section 9, imaging tests. Advanced imaging. Ultrasound, CT scan, MRI helps detect kidney disease, renal artery stenosis, adrenal tumors, brain stroke, structural abnormalities. Imaging is recommended when hypertension is severe, resistant, or sudden. Section 10. Genetic and emerging tools. New diagnostic tools include genetic testing, wearable, BP devices, telemonitoring, AI-based analysis. These help identify risk earlier and personalize treatment. So this was a complete guide to how hypertension is diagnosed, based on detailed medical research from BookEHealth.
In our next video, we will break down the hyper versus hypo.
If you found this video helpful, please like, share, and subscribe for more health-focused content.